So within the cardiovascular drugs, we are going to see and discuss about the anti-arrhythmic drugs in the first class. Then in the second class, we are going to see about the anti-hypertensive drugs. So anti-arrhythmic drugs. So before we start, we should know what do we mean by arrhythmia. Arrhythmia in simple words means irregular heartbeat. Either it can be a slow heartbeat or it can be a fast heartbeat. So any irregularity in the heartbeat refers to arrhythmia. Now this arrhythmia is caused due to abnormality in impulse generation or the formation of impulse. So the action potentials, they arise from the heart, which are responsible for contracting the muscle of the heart. If there is any problem in the formation of this impulse or in the conduction of the impulse, it might lead to the development of arrhythmia. That is, the heart beat will become irregular in nature. Either it can be very fast or it can be very slow when compared to the normal heartbeat. So all the chambers of the heart, that is the atria and the ventricles, they contract in a rhythmic manner. That means at particular intervals they keep contracting all the time. The atria contracts followed by the contraction of ventricles. Now this contraction of atria and ventricles is due to the generation and the conduction of electrical impulses. So these electrical impulses, they start from the sinoatrial node of the heart and they conduct. That means they are transported or they are transferred or they travel to the atria followed by the ventricles. So as they are generated and they are transported or they are traveling through the atria will contract. Then these impulses, they travel to the ventricles and the ventricles will contact, no, sorry, contract. So these electrical impulses are generated and conducted. Conducted means to travel throughout the heart, and the heart muscles, it contains its own specialized cells that leads to the generation of impulses even if there is no action potential from the brain. So heart, because it has to contract and relax at a particular pace, at a particular rhythm all the time, so it is not dependent on an action potential always coming from the brain and then the heart is contracting. So it has its own specialized cells which automatically generate the impulses by itself, and these impulses, they are generated and they also transfer to the complete muscle of the heart, thereby leading to the contraction of the heart. If there is an increase in the automaticity, it will lead to increase in the impulse generation. So if these specialized cells are generating electrical impulses at a faster rate, then what will happen? The impulse generation will be fast and the heart rate will also be fast. If the automaticity is decreased, if these cells are generating the impulses at a lower rate, it will lead to decrease in the rate of impulse generation, thereby it will also lead to decrease in the heart rate. So together, cardiac arrhythmia is a group of disorder which is characterized by abnormality in either impulse formation or impulse conduction in the myocardium or in the complete heart. So myocardium is the muscle of the heart, the layer of the innermost layer of the heart. So cardiac arrhythmia is nothing but it is characterized by either a defect in the formation of impulses or the traveling of impulses, which might lead to either too fast heart rate or too slow heart rate. To understand it more clearly, we must know what is the conduction pathway of the heart. Conduction pathway means how the impulses are starting and how they are traveling in the heart. So first the impulse are generated in the SA node, that is the sinoatrial node. From the sinoatrial node, the impulses they travel to the atria. When the impulses are traveling through the muscles of the atria will contract. And then the impulses they go to the AV node, that is the atrioventricular node. From the atrioventricular node, they travel to the muscle which is known as bundle of His, the left and the right. This is the bundle of muscle which is present in between both the ventricles. So bundle of His is a muscle which is present in between both the ventricles. So the impulses they start from the SA node, then they go to the atria. From there, they go to the AV node. From there, they go to the bundle of His, the left and the right branches. And from there, it goes to the walls of the heart. The muscles of the walls of the heart is known as the Purkinje fibers. Purkinje fibers are those muscles which are present in the walls of the heart. Thereby, when the impulses they travel to the walls of the heart, the ventricles contract. The SA node is called as the pacemaker of the heart. That means the SA node defines or it helps to maintain a pace, it helps to maintain a rhythm of the heartbeat. Dysfunctioning of either the impulse generation or conduction at any site in the heart can cause an abnormality in the cardiac rhythm. So if there is any problem either in the generation at the SA node or if there is any problem in the conduction of the impulses, then what will happen? There will be change in the rhythm. There can be a faster heart rate or there can be a slower heart rate if there is any problem in the generation of the impulse or traveling of the impulses through the muscles of the heart. Types of arrhythmias. Arrhythmias are broadly classified into fibrillations and flutter. Fibrillations means it is some electrical problem in either the atria or the ventricles. It can be an atrial fibrillation or a ventricular fibrillation. Now what happens in this fibrillation? It will lead to absence of P wave. Now what is P wave? It is a wave which is denoted in the ECG, electroencephalograph. So in the next slide, I will explain you what is an ECG. So the P wave denotes the contraction of the atria and the QRS complex, it denotes the contraction of the ventricles. So from the ECG, the doctor can identify the problem in the heart. If there is an absent P wave, that means there is some problem in the contraction of the atria. If there is any problem in the QRS complex, then it denotes that there is some problem in the ventricular contraction. So this is known as fibrillation. Flutter means they are highly organized, disturbances in the rhythm. Usually it will be seen in the atria. So atrial flutter, it will produce sawtooth like flutter waves along the baseline. Sawtooth means very small like this. Like this waves will be seen. That is known as flutter waves. It is usually seen in the atria. So atria, they contract irregularly and gives such type of waves. That is known as atrial flutter. Now, what are the medical terms used to determine the arrhythmias? As I told you, arrhythmia means it can be either slow heartbeat or it can be either a fast heartbeat. If it is a slow heartbeat, it is denoted as bradycardia. Bradycardia means decrease in the heart rate. Tachycardia means too rapid heart rate. That means increase in the heartbeat or increase in the heart rate. That is known as tachycardia. If it is irregular, then it is denoted as either atrial fibrillation or ventricular fibrillation. So these are the terms which are used to denote the arrhythmias, the bradycardia and the tachycardia. Now there are definite terms depending upon the number of heartbeats. If the heartbeats are too much, that is 400 to 600 beats per minute, then it is known as fibrillation. If it is in the range of 250 to 350 beats per minute, then it is known as flutter. It can be either atrial flutter or ventricular flutter. 150 to 250, it is known as paroxysmal tachycardia. Paroxysmal means sudden. Sudden tachycardia. Tachycardia means increase in the heart rate. 100 to 150 denotes simple tachycardia, and above 100 it is denoting tachycardia. So anything above 100 is tachycardia, but these are the ranges which gives it a more specific name. The normal is 60 to 100 beats per minute. This is all about the faster heart rate. When you come to the slower rate, you can see bradycardia, 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 and bradycardia. Mild, moderate, severe. So below 60 is bradycardia, 40 to 60 mild, 20 to 40 moderate, less than 20 is severe bradycardia. So tachycardia means faster heart rate, bradycardia means slower heart rate. Now, how can we determine if there is any problem in the heart? Whether the contractions are proper, where is the actual problem lying? If there is tachycardia or if there is bradycardia in the heart, consistent tachycardia, consistent bradycardia, then how to determine where the actual problem lies in the heart? It can be determined with the help of an ECG, electrocardiography. So you all might know that ECG is the recording of the electrical activity of the heart. So the electrical activity, how the impulses are generated, how they are traveling, all these things can be recorded with the help of an ECG by placing electrodes on different parts of the body on the skin. So these electrodes, they are responsible for detecting any tiny electrical change on the skin that can arise from the muscle of the heart. So it denotes the contraction of the heart, it denotes the relaxation of the heart with each heartbeat. So in one heartbeat, what is the depolarization, that is contraction? How is the repolarization occurring, that is relaxation? Everything will be denoted with each heartbeat in the with the help of a ECG. So ECG gives out, defines, or it shows everything, all the electrical activities which are happening in the heart. and it is a very common cardiology test. So if there is any problem with the heart, the first thing the doctor prescribes is to go for an ECG. It is a diagnostic test for any sort of heart problem. Now in the ECG, you might have seen, if you see an ECG, you will see some graphs like this. Now if you expand one graph, it will look like this. It will have a P wave, QRS complex, and a T wave. So one segment of the ECG looks like this. This is for one heartbeat. So when heart beats one time, this graph will be generated. So similarly, we have so many heartbeats in 1 minute. We have 60 to 100, okay, normal 72 to 78. So many heartbeat means one beat denotes a PQRST complex. Okay, so PQRST wave, this complete denotes one heartbeat. So if in a normal person, in a normal resting heart, the physiological rhythm is known as normal sinus rhythm, NSR. So in the normal ECG, we can see a P wave, a QRS complex, and a T wave. So we can see P wave, QRS complex, and a T wave. Now, if there is any deviation from the normal, it is known as cardiac arrhythmia. So if, for example, if the P wave is absent and directly we are having QRS complex, then we can catch what is the problem. If the QRS complex is small, or if it is very big, or if the T wave is inverted like this, or if it is absent, so depending upon what changes are seen in the ECG, we can determine what problem, or we can diagnose the problem, the actual problem present in the heart. If the rate is too fast, I told you it is known as tachycardia, and if the rate is too slow, it is known as bradycardia. So this is one which is known as P wave. 2 is QRS complex, and the third one is the T wave. So this complete denotes one heartbeat. Now if there are 72 heartbeats, then again we will have PQRST, then again PQRST. So similarly, this forms the complete ECG. So what does each wave denote? Now you know there is a P wave, there is a QRS complex, and there is a T wave. But what does each denote in the heart? The P wave represents the atrial depolarization. So depolarization, in simple words, you can understand contraction. So when the atria of the heart contracts, it will give rise to a P wave. So when the atria contracts, a small P wave will be generated. This is the electrical changes that is happening in the heart. So when the atria contracts, a small wave will be generated. QRS complex represents ventricular depolarization, that is contraction of the ventricles. So when the ventricles contract, this graph with this wave will be generated. The QRS complex will be generated. The T wave will be generated when the ventricle relaxes. That is ventricular repolarization. Repolarization means relaxation. So the T wave is generated when the ventricles relax. So P is for atrial contraction, QRS is for ventricular contraction, and T is for ventricular relaxation. Now, if the waves are irregular or any wave is absent. So I've picked few important examples. For example, if the P wave is absent in the graph, so you are seeing an ECG and you are not finding any P wave, and you are also seeing that the QRS complex is very irregular, then it denotes that it is showing atrial fibrillation. So in this graph you can see, you cannot see any definite P wave. Actually a P wave should be there, then QRS, then T. P, QRS, then T. So you can see all the time the graph is irregular. Here you are having T, here the distance is long. So this shows that there is an irregularity in either the impulse generation or formation. So that denotes atrial fibrillation. If the QRS complex is like a sawtooth, then it denotes atrial flutter. So you can see here, saw means, you know what is a saw, I think, with which we, it will be like this. Saw means for cutting something. So it will have small teeth. So similarly, you can see small teeth over here. So if the ECG looks like a sawtooth pattern, then it denotes atrial flutter. Sine wave pattern. So if the graph is like a sine wave, it denotes ventricular flutter. If the P wave is absent and the QRS complex is very wide with fast rate, then it denotes ventricular tachycardia. So in this graph, you can see there is no P wave. Only QRS complex is there. That too, it should be thin like this, but here it is broad. Then it is denoting ventricular tachycardia. That means the ventricles are contracting more fast. Depending upon the site, ventricular arrhythmia means if there is a defect in the ventricle. Supraventricular tachycardia, it has sinus arrhythmia. Types of supraventricular tachycardia are if there is a problem in the SA node from where the impulses generate, then it denotes sinus arrhythmia. Atrial arrhythmia, that means there will be a problem in the muscles of the atria of the heart. Junctional arrhythmia, that means there is a problem in the AV node, atrioventricular node, which is actually the connecting link between the atria and the ventricle. That is why it is known as junctional arrhythmia or nodal arrhythmia. Now coming to a syndrome which is known as Wolff-Parkinson's White syndrome. In this, the main problem is the impulses they generate from other sites apart from the SA node. Actually, the impulse has to be generated from the sinoatrial node. But if someone is suffering with Wolff-Parkinson syndrome, the impulses generate from other site, not from the SA node. And these impulses, they travel along different pathways. Thereby, they lead to different depolarizations and they trigger arrhythmia. So if you see in this picture, the normal electrical pathway from the SA node, the impulses are generated, they travel to the atria, then they travel to the AV node. From the AV node, they go to the bundle of hairs and then to the Purkinje fibers. But in this syndrome, what is happening? The impulses are not starting from the SA node. They are starting from the AV node. And what are they doing? They are traveling to the bundle of his Purkinje fibers and again they are going back to the AV node. So what will happen? This will generate some irregularity in the heartbeat. That is known as Wolff-Parkinson's syndrome. That means they will take accessory pathway, that is extra pathways, and the impulses actually do not generate from the SA node. Antiarrhythmic drugs. Now we have seen what is arrhythmia, what are the types of arrhythmia. Now what should the drugs do if the arrhythmia arises, or what should the drugs do to restore the normal heart rate? So there are drugs which actually block the ions, because if there is problem in the depolarization and repolarization, it is all because of the ions, the sodium ions, the potassium ions, the calcium ions. If they are entering and leaving the cell irregularly, it will lead to depolarization, and it will lead to irregular repolarization. So complete contraction of a cell, complete contraction of a muscle basically depends upon the ions, the sodium, potassium, and the calcium ions. So that is very molecular pharmacology. So you just have to remember that the ions are responsible for contraction and relaxation of a muscle. So if there is any irregularity in the entry and the leaving, that is the exit of the ions from the cell, it might lead to disturbances in the contraction of the muscles. So antiarrhythmic drugs, they modify and restore the normal property of the heart. How are they going to do that? They will do that by blocking the different ion channels. So we have sodium channel blockers, potassium channel blockers, calcium channel blockers, and beta adrenergic blockers. So three ions will be blocked: sodium, potassium, and calcium. So as I told you earlier, ions plays an important role in contraction and relaxation. So if these channels are blocked, there are chances that the heart physiology might be restored. And beta blockers also, we have studied earlier how these beta blockers, they are responsible for reducing the heart rate and relaxing the heart. So in a manner, they are also used for controlling the arrhythmias. So basically, many factors can precipitate arrhythmias. It can be due to hypoxia, ischemia, electrolyte abnormalities. As I told you just now, any disturbances in the ions. Electrolytes are nothing but ions. Excessive catecholamine exposure. So what are catecholamines? They are the hormones which are secreted from the adrenal glands. That's dopamine, norepinephrine, epinephrine. So excessive catecholamine exposures also lead to arrhythmias, or overstretching of cardiac fibers also leads to irregular heartbeat. When the muscles of the heart are working very hard and then they are stretching over a period of time, then the impulses take time to travel to the heart. Thereby, till that time, an irregular beat will arise. So basically, whatever the reason or whatever the factor might be, all the arrhythmias, they result from disturbances in either the formation of impulses or the conduction of impulses. So these are a broad category of drugs which helps in, or which helps to control the arrhythmias, which helps to keep the impulses in a controlled form, the generation and the traveling of impulses, and also the irregular contraction of the muscles. So these are the different classes of anti-arrhythmic drugs. So I hope it is clear for all of you.